but as it turns out, somebody who talks straight. One of the things that I really like about him, and one of the reasons why I'm optimistic that we're going to get a health care plan, is he doesn't give political speeches. He doesn't give adorned speeches. There are no ornaments. He just talks. It's sort of like Roosevelt's fireside chats without a fireside, without Roosevelt. Roosevelt kept the country going, lifted people's spirits up simply by the sound of his voice over radios, which fortunately had been invented and people listened to like crazy. He has the same effect on people. And I mean, I remember he had a very hard time in southern West Virginia, and I know that. And I took him down there. Sharon and I took him down there and introduced him at the Bluefield Armory, which, incidentally, for the first time in all of my experience in public life, was full. It was absolutely jammed. I didn't even realize I had a second-tier balcony. And they didn't go for him, but they listened to him. They had their first exposure. Just like I had to have my first exposure. And he was funny, but he was terribly serious, but he was not boringly serious. He was humble and serious. And you could tell that his whole cycle in life, a very difficult cycle for him, had made him into somebody who really cared about what it means to come up the hard way and do it the right way. So I trust him. So now this health care package is you know, I missed a meeting this morning because I thought I was meant to do physical. I'm just winding up on physical therapy, ripping my quad from my kneecap. Don't do that. Do not do that. And it takes a while just to get everything going again. But we're going to get a bill. And now there's another part of this bill, which I began to talk about, and got diverted, which is very unusual for me. And that is this med pack, and that is, how do you decide what a doctor who works for the Mayo Clinic, for example, should be reimbursed for a Medicare episode? Or how much the hospital itself should be reimbursed for a medical episode, versus how much somebody who works for Raleigh County General Hospital should be reimbursed. Now, people say we don't want the government deciding that. But on the other hand, there are an awful lot of veterans that are pretty grateful for the Veterans Administration and all their hospitals. They've got improvement to make, but they're getting so much money now from the government. It will be for years to come, because we owe them so much, and we haven't come through because veterans' health care has not been, you know, a sexy subject. Well, it's a real important subject, especially after what they've done for us. And so we just decided that it didn't really make a whole lot of sense for 535, and I'll just use the word that I hate to use, politicians should decide who got reimbursed how much in some rural town in Nebraska as opposed to some emergency room in Chicago, for those few emergency rooms that still exist in Chicago. And so take it out of the hands of the politician, which is the way we've been doing it. Every year we've been doing it. And take it out of the hands of the lobbyists. Because the lobbyists make an awful lot of money wandering through the halls of Congress, each of them representing one particular part of the healthcare industry. Like it might be this, or it might be wheelchairs, or oxygen, or, you know, but they represent one particular little piece. And they're paid to make sure that that little piece, and that company that makes all those pieces of that industry, gets as much reimbursement as they possibly can. And that's the way the system has worked forever. I think it's a lousy way to reapportion healthcare money, that would be your dollars, to them. So I proposed what the Congress proposed, but never gave me power to, in 1997, and that is you give it to a group of experts. And I don't really know most of the people on the board, but they're a terrific group of people. They're professional healthcare experts. They can tell you how far outside of Pittsburgh you have to drive, or how close to Wheeling you have to be before prices go from here to here, or from here to here. It's important information in terms of fair reimbursement for institutions and for practitioners. So we say, take it away from politicians, take it away from lobbyists, and give it to the professionals. And so now there's a fight that's going on. I'm on one side, and not everybody's on my side, but we've won some, haven't we? Yes, we have. That they decide, and then the Congress doesn't get to vote on it. They decide what it should be, and there's an advisory board, because it's within the jurisdiction of Congress, so you've got to be careful about that. So there's an advisory board of consumers and practitioners and healthcare experts, etc. But they get to decide, and whatever they decide, that's it. Because if you then take it back to the Congress and say, okay, now vote on it, well, then you're right back where you were at the very beginning. Because the lobbyists all know that. And so they're starting their work, 2 years in advance to tell you that we just don't have enough oxygen for whatever, etc. They're probably right, but the point is that everything is hard, and you've got to apportion things fairly and to the advantage of the most people, and you've got to do it fairly. That's the most important thing. You've got to be honestly done, pure heart. So I say no vote. No vote. It just becomes the law. And that's the way we'll do it from now on. And we'll have to make some adjustments, I'm sure. You always do. But I'd much rather have a professional, if I were my daughter Valerie, a professional deciding how much well, she doesn't exactly fit into Medicare, does she? Well, let's pretend she does. That her OBGYN is reimbursed properly according to where she has the baby, what are the circumstances, what was the nature of the birth, all the rest of it. It should be done that way.